Number first, a very important vesicular bullous disease we're gonna study is, so let's start it. Bismillahirrahmanirrahim. It is actually Pemphigus vulgaris. Okay, it is a Pemphigus vulgaris, um, named by Wickman and basically derived from the Greek word pemphigus, which is a means bubble or blister. Now it is a group of uncommon autoimmune means it is an autoimmune disease, intraepithelium blastering disease that affecting the skin and mucous membrane. Okay, it is means autoimmune means it will be now throughout of the life. Intraepithelium means within the epithelium, means between the epithelium cells. Like blastering means the blaster is forming this and it affects the skin and mucous membrane. We have four types of this. Pemphigus vulgaris is the most common. The second is Pemphigus vegetans, then the Pemphigus erythematis, then we have Pemphigus flaccus. Only first two types are oral mucosa, means the vulgaris vegetan affects the oral mucosa, and the vegetans are rare, and most authorities consider it as a variant of the Pemphigus vulgaris. Okay, now pathogenesis. The pathogenesis is very important of Pemphigus vulgaris. So basically what happened that we have seen this is an autoimmune disease. So autoantibodies are formed against basically dysmoglein 1 and 3. Then these antibodies attach to the desmosomes. When it attached to the desmosomes, so basically it inhibits the molecular interaction and basically which is responsible for the adherence. Now there will be a split developed within the epithelium and cause the blaster formation. Okay, means the autoantibodies are formed against desmoglein 1 and 3, which are actually a surface glycoproteins, and then they attach it to these desmosomes basically, which is actually bind the epithelial cells each together. Then what happens when it inhibits the molecular interaction which is responsible for adherence, and there is a split is developed within the epithelium, and there is a blister formation. Okay, so dramatical point of view. Clinical features, it affects the middle aged people like 45. It is more common in females and characterized by a spread of bullous eruption involving the skin and mucous membrane. It is more common in certain ethnic groups like South Asian people have more, and Jewish heritage people. Now the oral lesions, how it manifests. So basically 50% of all cases has means the oral mucosa is involved in nearly all patients. 50% cases initial lesions. Now first, second, there's a crusted or whipping areas of this denudation on the skin, means the skin has denuded, means an irregular and rigid oral mucosal abscess. Okay, now basically it involves soft palate, buccal mucosa and lip, which is most frequently involved, and it also be a type or a condition of desquamated gingivitis. There may be also a patient has desquamated gingivitis. Clinical features, it has acantholysis, yes, basically, and then this is a process that expands literally into the surrounding epithelium for the considered distance. Now, very important that the Nikoski sign is positive in this. What is Nikoski sign? If the patient has, like, consider it, this is a hand and the lesion is present on this area. So when pressure is applied on this area, so basically the superficial layers or the top layers of skin slip away from the lower layers when it is rubbed. So in this case it is negative. Remember, it has flaccid vesicles and bulla that rupture within hours after few days and leaving an erythematous denuded surface, means the bullas form, vesicles are formed, and then basically they rupture and they leave an erythematous denuded surface. The ocular lesions are infrequent, but bilateral conjunctivitis can be occur in this patient. This is the Nikoski sign, which is positive. Disloading of epidermis by lateral fingers pressuring the vicinity of lesions, which lead to the eruption. And then sharing the stresses on normal skin can cause new erosions to form. Okay, this is a video. Okay, so okay. This is the common signs in which you find the Nikoski sign positive. In Pemphigus, you can see. Then in the Staphylococci, scale skin syndrome, in Stevens Johnson syndrome, and epidermolysis bulla has also positive this. Okay, you can see this lesion bulla formation. This is ruptured erode. Desquamated gingivitis, the patient has actually in early skin there's a blister, and then the blister becomes flaccid, and then the skin becomes erode in this area. Now